We're now moving to the part of the agenda which allows you to, the floor to ask questions. And I think, Phil, do you want a microphone now?
Yes.
Lovely.
Given I'm just an ordinary member of the public who happens to live somewhere in between Epsom and St Helier Hospital, and I'm horrified at the plans that are about to come about with BSBB. Given your amazing figures on your A&E results, how does the hospital feel when they're told by BSBB that your standards really aren't good enough and that you ought to be meeting some other, not the general standard test for hospitals, but some new London standard? How do you feel about the prospect of losing the A&E in this hospital and St Helier's?
Perhaps if I take this, a good question, an important one as well. I know that many local people are concerned about the future for the services that we provide. I think there's a couple of points to note. Firstly, about the BSBB process, these are proposals only at this stage. They need to be properly consulted on with the public in an open way, and ultimately decisions will be taken on the basis of consultation when that happens, and it's very early stages in that process. The second point, I think you're rightly raising the question of quality standards, and I think as each of our speakers has shown today, we don't rest on our laurels, and we're continuously looking at ways to improve the way in which we provide our services and our care. Now, the London Health Programmes has led the way across the NHS in trying to identify the kind of best practice quality standards that departments should be following in the future. And clearly the question for us is the difference between what we're doing now and how we might achieve those standards in the future. And in conversation with our commissioners, we're working through how and when we might be able to deliver those standards and whether they're affordable for the commissioners. So whether those are imposed through a BSBB process or indeed through local discussions with our commissioners, there's no doubt that our board is very keen to continue the journey of improvement and try and aspire to the best practice standards that are being talked about within the London Health Programmes. Our board position in relation to the BSBB process is clear. Our organisation has, for the last decade or more, been troubled, if you like, by a lack of strategic direction and a lack of coherence around the commissioning strategies that our local PCTs formerly and our clinical commissioning groups now. Now, if the clinical commissioning groups are absolutely committed to BSBB as a process, and the public view is that those are the right outcomes, then our board has to deliver the kind of services in the quality that the commissioners want us to provide. And there's no point us trying to provide services that people don't want to pay for, because that leads an organisation into financial ruin. So we're very clear we've got to work alongside the best service, better value process. But first and foremost, our priority is to continue the improvement in clinical and financial sustainability of the organisation.
Can I just come back to that very briefly? BSBB have said recently on Twitter that no amount of money can save the A&E in those two hospitals. They have said that on Twitter, and if you like, I can point you at where they said it.
That'll be helpful to see that.
And also they have said, in meetings and on Twitter, that the consultation is simply gathering views and opinions, and they cannot state what effect the results of that consultation might have on their end decision. They are not saying they're asking the public for a view. It is not a democracy, they have said. So it is not up to the public.
Okay, so I think those are helpful observations, and I know that Rachel, our Director of Communications, would be very keen to follow those up with the spokesperson on behalf of Better Services, Better Value. Anybody that was at the Epsom and Newell Borough Council Health Liaison panel last Monday will know that the BSBB spokesperson was very clear that it's consultation processes are genuine, open, and expecting the public to be able to contribute. So there's clearly some mixed messages, and it would be helpful to be given the source so that we can follow that up. But thank you for raising it.
Anybody else? There was a gentleman in the dark shirt waving his. Sorry, the gentleman had his hand up first, so we'll just deal with that one first.
Matthew, your accounts have been qualified again for the third year by your auditors. You were claiming not to be overpaid. When are you going to sort it out? Being financially resilient and being caring are not mutually exclusive. Also, I think you may find you've missed your MRSA target for the 10th year running.
Okay, thank you for those observations. You'll see that on page 46, the auditors, as you rightly say, have qualified the accounts. They have to do that on the basis that we've had a deficit budget, and the deficit budget was agreed with NHS London and subsequently with the NHS Trust Development Authority.
You've got additional taxpayers' money this year, not 12.3 billion, and you're still declaring another deficit. And this is under your aegis. You're claiming not to be overpaid, but when are you going to sort it out?
So I'm very happy to sit down with you and to go through the specific improvements that we've made. I think it's very easy to target organisations.
Excuse me, can you just allow Matthew to finish?
So there's no doubt that over the last 3 years we've seen an improved financial position, and if I can finish, the journey that we're trying to be on as an organisation is to reach a position where we're delivering clinically and financially sustainable services, and in the context of a health economy that is in financial balance. So we'll continue on that journey. The auditors rightly can only qualify accounts on the basis of an NHS trust having a deficit, but I would draw your attention to the improved deficit position and the projections that we're making this year and in subsequent years. In relation to the MRSA point, I think it is clear from our perspective that every MRSA bacteremia is a serious event. We are continuing to improve our position. Our last year that's reported in our annual report, we had the same number as the year before, but 4 of those were not actually bacteremias, they were contaminated samples. And the year to date, we've had 2 only this year in the first 6 months. So you can see that our rate of improvement and our rate of reduction continues year on year. You can point to whether we've hit our target, but you can clearly see, and we can provide you with the data, that year on year we have reduced the number of bacteremias.
Phil, there's a lady in a green jumper. Thank you.
Yes, I'm a borough councillor from Elmbridge. I also sit on Surrey County Council's Health Scrutiny Committee. This is a question really sort of slightly unrelated to what you've just been talking about, because I'm talking about more recent events. Could you tell me the challenge, amongst the challenges that you face, how have you been situated in regard to the 111 service since it was introduced in April, and also the patient transport service, both of which we have recently been looking at the Health Scrutiny Committee meeting?
And you're specifically talking about Surrey-based as opposed to... Yeah, so initially when the service transferred over to the 111 system, we did experience some challenges as the teething, some initial teething problems as the service started to embed, but actually we're seeing a settling down of those issues now. And one of the questions I think we were asked earlier in the year was the extent to which that has increased the number of attenders coming into our A&E departments. And actually year to date, the first 6 months of this year, we're seeing a broadly similar picture of number of attenders as in the previous financial year. So the 111 service in Surrey isn't having an impact particularly on the number of patients that are coming into our A&E departments, although we will continue to work with our local commissioners to see if there are ways in which community primary and social care services can enable some patients not having to make the journey unnecessarily to A&E. In relation to the changes locally on transport, we continue to work very closely with our transport providers, and we have different transport providers for different parts of our service. And I'm sure you're referencing specifically the CCAM patient transport service. We're working closely with the commissioners of the service and with the providers, because we are absolutely clear that transport, particularly for patients being discharged, has to be delivered in a really timely fashion, because sometimes our patients, when they're discharged, are waiting for, they'll have social carers waiting for them at home, and indeed family members. So we're being constantly vigilant to ensure that the service is as good as possible. And I think any transition from one provider to the other, there's always initial teething problems, and I think there's been some degree of experience of that. But we're working closely with the providers to iron those problems out.
Sorry, can I just ask, on the patient transport service, when you're looking at overall the sort of quality of the patient experience, will that be something that you will be including in the overall experience, even though I appreciate you don't have any direct control over it?
Absolutely. So, we take it very seriously for our patients that are experiencing the transport services. They might be provided by a different organisation, but we take our responsibilities, particularly our clinical governance responsibilities to the patients while they're in our care, very seriously. And if there's some patient experience challenges or safety challenges that are coming from any part of the service that's delivered by our contractor, we deal with that very, very firmly.
Anybody else got any questions? There's a lady at the back. Val's got a question.
Hi, just a very quick question. Is the banner at St Helier advertising his 319 million development going to stay there for the rest of his life?
Thank you, Val. Important question. So, as colleagues will know that we've kind of run aground a bit with the redevelopment programme of St Helier because of the need from the Department of Health's perspective for the Trust to demonstrate that we can afford the annual repayments on the investment to redevelop the site. And the Department of Health have been very clear with us that until the commissioning strategy is clear for our hospitals, they don't see that we can demonstrate the affordability of being able to invest that money. So until better service, better value as a commissioning strategy is concluded, i.e. launches consultation, decisions are made about the types of services, the income that we'll receive, it will be difficult to persuade the Department of Health that we can move forward. Now, the reason that the banner is still there is because we haven't lost hope that we will still be able to progress, and it's something that I've been challenged once or twice by my team about, to say, well, you know, the banner might be being a bit misleading, but I'm kind of quite sort of taken by the banner, and I'm reluctant until we can't move forward to signal that to our patients and our stakeholders. The other thing that we are obviously continuing to do is to invest in our sites, as I think is articulated quite nicely in the annual report. So whilst we might not be able to move forward with the big scheme at this stage, we are continuing to upgrade and improve our facilities as best we can in the meantime.
It's very misleading actually, because lots of the people I talk to are insistent that these cuts and possible changes are not going to happen because of that banner. And therefore, if you're going to have a public consultation, the public are in effect being misled as to what the future plans are. And they won't even engage with that process if they don't know it's happening.
Sorry, I'm not quite. Perhaps we can pick up those points elsewhere. I don't follow the logic necessarily, but perhaps we can pick that up outside.
So there's a gentleman next to the. Let's carry on with your Phil. There's a gentleman raising his hand with spectacles, white top.
I could say an awful lot about BSBV. It's a bad process, and the public are not being kept informed about it. In fact, the public were ejected from a CCG meeting because the CCG refused to answer any questions. However, that's not a question, that's just an experience. The question I've got to ask is this friends and family thing. I and members of my family have frequent outpatient connections with both hospitals. None of us has ever been presented with a friends and family form. I could put some very positive comments in. I could put some negative ones about St George's, and some extremely positive ones about St George's.
Yes.
Why is it done for outpatients?
Yeah, it's a good question. So
And when you're sent a letter with an appointment, just enclose the form and say, after you've been, will you please fill this in?
Yeah. So the reason that we haven't yet moved to outpatient forms is that the government expectation was A&E and inpatients first. We're in the process of launching the Friends and Family Test for maternity services, which was the next stage. And Hilary, I'm assuming that we'll be doing the same with outpatients in due course. Now, that shouldn't stop you sending in your positive comments. There is this thing called NHS Choices, where it's quite straightforward to leave your comments, good or not so good. And in due course, the Friends and Family Test for outpatient services will come into being. But the expectation of hospitals was to launch A&E and inpatient surveying first, and that's why it hasn't yet progressed to outpatients.
Well, I'm not directly certain about this, but I have 2 grandchildren who've recently gone to A&E with fractures, one in the spine and one in the forearm. I don't think any friends and family form was presented to
Okay, that's
the
helpful
parents.
feedback. We'll take that back. I don't know, John, do you want to answer?
Yes, at the moment it's 6 patients 16 years and older, it's not paediatrics. Sorry, I'm not used to this. Yeah, it doesn't apply to children, okay? But after the meeting I can talk to you again about it if you wish. Yeah.
Phil, can a lady wearing a green jacket in the third row?
Live, is it? Thank you very much. I'm Councillor Jean Steer from Epsom Your Borough Council. And you referred to our health liaison panel, which I have to say has had several meetings and presentations from the VSVB. And I do say that until they start the process of the consultation, nobody can really say how it's going to end. I just urge everybody that gets any opportunity to write in. We can address what their results are when we know them. But at the moment, they're all just saying they're going to do a consultation. There's no sign of it being done. And just an observation, 2 or 3 of your presentations have stressed the importance of A&E and in finding out that people have got cancer in one case and all the other things. So I'm supporting the urgent stay of the A&E next.
Thank you. Right, there's a gentleman over here who raised the... And then I'll do the lady in orange, and I think we'll have to move on before the building closes down. So. The gentleman with the blue tie.
Well, this is just to support the answer. Like if you want to give any follow-up, generally, I forgot the word, feedback, they can give it to the health watch searcher. So whatever positive or negative, whatever the type of feedback you want to give.
Yeah, I'm concerned about the numbers. If it's not actually presented to you directly, like in an envelope with your appointment letter, or when you walk out or into A&E, you're not going to fill it in. Nobody's going to know to send it to the body that you just mentioned.
Yeah.
And it's not included in any large collective set of statistics, so you might just as well say thank you.
But you can still raise these points through the health watch.
Okay.
Thank you.
Thank you. There's a lady with an orange top.
Hardeep Matharu, Epsom Guardian newspaper. Just wanted to ask how the demise of the edicts has impacted upon Epsom and St Helier hospitals, and if you know how long those hospitals will be providing services for the displaced patients.
Thank you. Yes, so the recent changes that Surrey Downs CCG have brought about in the way in which they're commissioning services and expecting their GPs to refer services and the closing of the contract with EDICS, which is the Epsom, for those that aren't local, it's the Epsom Downs Integrated Care Service, which is a local GP provider that's been in place for a number of years. We've picked up many of the patients that would have been waiting a long time if there hadn't been arrangements put in place in partnership with the CCG, and we're in the process of treating around 1,200 patients that were referred into EDICS. The next stage of that is then to work with the Surrey Downs Commissioners to identify the best quality and the most cost-effective way of managing the patients that would previously have been referred by GPs into the EDICS service, and those discussions with commissioners are ongoing. I would suggest that an opportunity to check out with the CCG later in the year about progress would probably be the best way of understanding the next steps. In relation to the impact on the hospitals, there's no doubt that more patient activity of the type that EDICS service would have been treating, so things such as first outpatient appointments, some diagnostic tests and small minor procedures, is the kind of bread and butter patient care that a district general hospital provides. And so long as we are able to treat those patients and it doesn't cost us more to treat them than the income that we will get under the national tariff, it would be a good thing both for the patients because they get treated locally at their local hospital, and secondly for our bottom line because it improves our financial position.
Yeah.
Okay, so one last question.
Hi, it's just a quick question about the employee benefits. They seem to have gone up by about 7.4, 7.5 on the previous year. I just wondered what benefits the hospital have seen for the increased costs.
Kusha, do you want to? Okay, so you'll follow up separately. Okay, thank you. Okay, well, I'll just call the Q&A section. I'll bring it to a close now.